Hello, I'm Joanne Buzaglo, and I'm a behavioral scientist, and I lead our efforts to incorporate patient-reported outcomes into clinical care and data science at ConcertAI. Today, I'm excited to tell you about how Concerto's electronic patient-reported outcomes system, the Patient Care Monitor, can help create a culture of excellence at your organization and improve quality of care, and how practices meet quality metric standards for any number of certifying bodies. The results I will be presenting today will be published as an abstract in May at ASCO Virtual 2020. So as I talk to practices across the country, I have learned just how committed staff are to providing the highest quality of cancer care. I've also discovered how many practices are still collecting patient-reported information by paper and pencil. Now more than ever, we understand the need for digital solutions, especially given the amount of things that are required by certifying bodies. The study purpose was fairly straightforward. It was to document and demonstrate the effectiveness of using an electronic patient-reported outcome system to facilitate compliance with any number of metric reporting standards. We chose to look at smoking status by assessment office visit, which is a core COPI standard, as well as fall risk assessment. This study used a retrospective observational design using the Patient Care Monitor, Concerto's web-based ePRO system. All of the study data were collected as part of routine clinical care at West Cancer Center, a community cancer center in Tennessee, as part of routine clinical care at the initial visit a patient visited the office. The data was collected between January and November 2019, an 11-month interval. And patients completed surveys, a number of surveys via e-tablet, including a tobacco usage survey and a brief false risk assessment. A report was delivered to the physicians and the nurses in real time, so that they had a report in which they could see trends over time of symptoms, of patient symptoms, before they met with the patient, and also could be used during the consultation. The survey data is seamlessly integrated into the EMR for later report generation. So our top results have pragmatic implications for the delivery of quality cancer care. First and foremost, we were able to screen over 6,500 patients over an 11-month period without significant clinical staff involvement. And that's important when I think about the conversations I've had with practices across the country, just how overwhelmed they are with work. And simultaneously, they were able to receive and obtain rich, actionable data required for quality care and for the consultation itself, while automatically documenting these standards, tobacco usage status or false risk, that could be later used for easily generated reports. So looking a little more closely at the data themselves, what we see to the left is that 22% of patients indicated that they had at least one fall over the past 6 months, and 12% reported a recent fall within the past 3 months. If we look to the right, what we see is that just under a half of the patients reported having ever had used tobacco. 15% were current users. And amongst those, 34% used cigarettes, 4% cigars, 3% e-cigarettes. And this kind of information, this aggregated data, can be very helpful to a practice as they try to plan for the resources they may need to provide services to their patients, such as a tobacco or smoking cessation program. So all in all, Concerto's ePRO system, the Patient Care Monitor, creates clinical efficiencies gained through EMR integration. And what we see is that, without interfering with the practice flow, patients can receive an in-clinic survey. Then that data can then be used during the consultation itself, or we can deliver mobile surveys at home, which can send alerts to the providers and could prompt a telehealth visit. Also, the administrative platform allows the administrators to generate reports that can be used for any quality metric standard reporting requirements. So why is this important? Why are we speaking about this today? Well, first and foremost, we were able to screen close to 7,000 new patients out of practice without significant clinical involvement. Second, an ePRO system can be used to monitor not only tobacco usage and falls risk, but other symptoms as well and risks. In particular, in today's climate, we can screen for COVID risk via remote ePRO monitoring to help keep patients and staff safe, sometimes choosing to keep patients at home rather than bringing them into the clinic. An ePRO system could be something that could be an effective tool in your organization and help create a culture of excellence characterized by a systematic approach in which no patient is missed, where quality care is enhanced by actionable information, and where this system can create clinical utility and efficiencies to reduce the clinic load. So I want to thank you. I hope that you found this presentation helpful. I would be delighted to speak to anyone about how they can integrate an ePRO system into their clinical practice to provide the highest quality of care to their patients and to reduce clinical staff load. Thank you.